Cedar fever is a type of allergic reaction that occurs in some people who are exposed to pollen of a certain species of juniper trees. It's often mistaken for the flu or a virus, however, it's actually an extreme allergy that often appears in the winter months. In this video, we'll discuss the causes, symptoms, and treatment options for cedar fever, as well as some ways to prevent it. So, if you're ready, let's get into it. There is a common misnomer about this condition because cedar fever doesn't actually come from an allergic reaction to cedar trees. Instead, it's caused by the juniper tree pollen commonly found in central Texas. These trees release a large amount of pollen into the air that can be windblown hundreds of miles from its original source. Furthermore, the trees have unique pollination patterns and release their pollen in the air following a cold front in the winter months. Therefore, the weather conditions from December to early March are ideal for the spread of this pollen, which causes many people to experience the unwanted signs and symptoms of cedar fever. It's important to note that some people are more sensitive to the pollen and are more likely to experience an allergic reaction. The signs and symptoms of cedar fever may include nasal congestion, sneezing, a sore throat, mild fever, itchy and watery eyes, itchy nose or throat, cough, headache, fatigue, plugged ears, and a loss of taste or smell. Cedar fever is an allergic reaction that shares symptoms with common illnesses such as the flu or common cold. However, one key differentiator is that cedar fever often causes itchy, watery eyes and severe nasal congestion. Furthermore, the symptoms are often worse for people with pre-existing conditions such as asthma, COPD, or chronic bronchitis. So if you experience any of the above mentioned signs or symptoms, it's best to consult a doctor for proper diagnosis and treatment. Now let's talk about the treatment options that are available. Cedar fever symptoms can be annoying and disruptive, but fortunately there are several ways to treat and manage this condition. One of the most effective ways is to avoid exposure to the allergen. This means staying indoors on days when the pollen count is high, using filtered air conditioning, and keeping windows and doors in your home closed. You should also consider avoiding activities that stir up pollen, such as mowing the lawn. If you must go outside, consider wearing a face mask to reduce your exposure to pollen. Some over-the-counter or prescription medications can also help relieve the symptoms of cedar fever. This includes antihistamines, decongestants, and nasal corticosteroids. Antihistamines work by blocking the action of histamine, which is a chemical produced by the body during an allergic reaction. They can be taken orally or applied as nasal sprays to reduce nasal congestion, sneezing, and itchy eyes. Some examples include Claritin, Zyrtec, and Allegra. Decongestants work by narrowing the blood vessels in the nasal passages, which helps to reduce swelling and congestion. They can also be taken orally or applied as nasal sprays. Some examples include Sudafed and Sudafed PE. Nasal corticosteroids work by reducing inflammation in the nasal passages, which can help to relieve congestion and other symptoms of cedar fever. Some examples include Flonase and Nasonex. Keep in mind that stronger versions of these medications are only available with a prescription, so talk to your doctor or pharmacist about which one is right for you. As previously mentioned, cedar fever typically occurs from December to early March. Some people may experience symptoms for the entire duration of the pollen season, while others may have symptoms that come and go. While it can be frustrating, it's important to remember that cedar fever is manageable with proper treatment and precautions. However, if you are experiencing severe symptoms or are not responding to the over-the-counter medications, please speak to your doctor for additional help and guidance. If you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.